Good afternoon, everyone. It's a pleasure to see people in person. My name is Milly Castañeda Ledwith. I am the Director for Community Engagement of UNM Hospital. Today, thank you to Robert to having us. We wanted to listen to your voices. We have been learning all morning, and now is the time for us to learn from you. So this is today's agenda. And our why. Why are we doing a community engagement listening session today? UNM Hospital publish a community health needs assessment every 3 years, as any other nonprofit hospital or healthcare provider. We are, it's our plan to give back to the community. We have been meeting with different groups, New Mexico Mission for the Deaf and Hard of Hearing, for Spanish speaking. On Thursday, we have for people with disabilities. So we try to be out as much as we can, so the more the merrier. And then we will have some public forums coming in 2023 too. So this is the process of a community health needs assessment. Right now, we are in the gathering information. After we will compile and develop the plan and strategies. Right now, I see Sharon here. It's good to see you in person. We are working with the Department of Health too to synchronize all the community health needs assessment. So all the community institutions are coming together. You don't have to do a listening session for each of us. It will be more, like, okay, let's do this as a group and identify the needs of our community to develop a plan and strategies. So even if I represent UNM Hospital today, I wanted to hear your experiences as healthcare providers. How they're being, what can improve, what can we do better? So as a big, large system, it will take time. For community engagement in the hospital, it's this is just the beginning. The listening session, just the first step for a change. We wanted to report back to you. So part of the plan is we will have report back year 1 and year 2. So we just to let you know how we are doing. And where do you find that information? In our website. And we hope to connect with more of the community. So we will be more in events, and I hope our places see each other again. So in other events around the county. So just to start with a little fun, see how this goes. But if you have a cell phone, I have an icebreaker. So what we'll do, I will put a QR code. So it's alt and shift, right?
Yes. Tab actually.
Oh, wait. Okay. Let me see if you can scan it. Were you able to see the screen that you're seeing? Yeah? Okay. Can you tell me how you're feeling today? Emojis only. If you don't feel comfortable with, you can write a text too. So. As human beings have a lot of emotions, right? To tell and to say. And nowadays, emojis being a big part of our daily lives. Okay, we will go to the next one. Why is your dream vacation? Emojis only or text view?
We can interpret emojis.
Interpret is just, to each of you. Well, the first one is mine, so you know.
What did you want to do? You're on the beach?
We're on the beach in sun. But weather. A lot of food, a lot of sandwiches. Valley Beach Adventure, that would be nice. Other cocktails, heart, love, aliens. Would that be? Roswell? Just kidding. Okay, great. Let's go to the next one. What do you think of when you hear New Mexico? I like how home is just in the center of all, right? It's like they know what to do. Orgullo, yeah, thank you. Home, big sky, tumbleweeds, yeah. Go ahead. If you have a bike, you know. When I just moved to New Mexico 15 years ago, one of the things that I like about it, it was the friendliness of people. My accent was stronger, but I also identify with a lot of New Mexico, how do you look Hispanic, Latino. So I felt at home. And then just if they hear me speaking Spanish, in a restaurant or cafe, they will speak to me if they speak Spanish. So I felt really welcome. So I think it's a really welcoming state. Thank you for your participation. This was fun. Let's see. So the listening session, it has a few steps. Liz is a community engagement liaison. She will be taking notes. Your opinion will be anonymous, so we don't have names, and all the information that we are collecting today will go to the big community health needs assessment. So we are not going to answer because the goal for this community session is to listen to you and go back to leadership and find solutions, and then provide programming. So from the first step when you go to a healthcare provider, what is your experience? Walk us through, and the good and the bad. We wanted to hear it all, even if it's hard for us. Just please let us know. We had an amazing listening session with the community with disabilities, and we have parents telling us their stories. So I think, please don't feel, afraid if you use the microphone. we can have some paper notes and we can take it, but at the end of the listening session, what we're going to do is we will come up with 4 priorities that we can then add to the community health needs assessment. So we will pass the microphone, but the first question is, what have been your experiences with healthcare system, doctor, nurses, hospital, clinic, support staff? And anyone that wants to start, I think we just need to push this. Anyone?
Hard to get providers, it's hard to get them to see providers. A long wait.
Long wait. Yeah, it's access, so it's hard to get providers. I have 2 microphones now. Anyone else, can you tell me, I don't know, okay. Get to you. And then remember that we are trying to, going back to here in Marshall and Robert, is health equity. We wanted to try to reach or to improve our health equity in the state.
I agree with the last one, access in terms of the network for certain insurances, which is more of an insurance issue. But what I was going to say was that I was at UNM once for emergency, and I had just moved here, so this was almost 4 years ago. For me, it was just feeling rushed, and I had asked to speak with a supervisor, or not a supervisor, I'm sorry, a social worker, because I've been in a car accident, and I really wanted to talk with someone because I was having a panic attack. And they just thought that I wanted to speak with a social worker about insurance and paying. And so they just handed me a postcard that says, this is how we can help you get Medicaid. And I never spoke with a social worker to help me with my mental status, and I had to deal with it on my own.
We have a couple of comments from folks joining us online. One of them is gatekeeping treatments and medicine access. Another is inequitable waitlist practices. And one last one is, lack of welcoming and inclusive environments in clinic and websites.
Hi, I provide gender-affirming care. One of the biggest frustrations for me is when I see other clinicians in the UNM health system document with inappropriate pronouns for someone. And when it's very clear in all of our notes what their pronoun is, it's clear on there. Now that we've updated our system, and it'll say their pronouns on there. And I find that very, very frustrating, and I don't know what the path is to rectify that. And unfortunately, if someone has access to their healthcare records, they can potentially go in and see that. And I just think it's a way to potentially lose trust with patients. And I also worry about if the documentation is this way, what was their treatment like when they received those services? And it makes me frustrated and angry.
Thank you.
I've had a really varied experience with medical care. Once I had an emergency and I went to the emergency room and I was admitted, and because of bed shortages, I was kept in a room in the emergency department for about a week, and everyone was amazing. Like, the care was really, they were just really careful with how they approached me and making sure that they had my consent for everything, and being really empathetic to my situation. Even when they had residents come in and observe care, they were very considerate of what I wanted in that situation. But then in other instances, like going to the clinics or trying to receive any care for people with uteruses and ovaries, I've never felt like super safe or heard or comfortable in those situations. In the clinics, I've often felt really rushed and like I'm not being heard when I'm trying to explain the issue. And then with annual exams and things like that, I don't know if it's necessarily the people or if it's the culture of care that we provide to people with uteruses and ovaries that feels kind of unsafe. But yeah, so it's been really varied back and forth. Sometimes I've felt super cared for, and other times I've felt pretty excluded from my health journey, so.
Thank you.
We have a couple comments. I'm actually gonna move, but we have a couple comments specifically to do with rural areas and how there's limited support in these rural communities and the proper use of pronouns in these rural communities, how it could be a safety issue. We have another comment about ignorance around terminology, like the difference between LGBTQIA+ identifying and LGBTQ+ friendly therapists and providers. And a few other notes, especially to do with legal names and chosen names and charts, consistently being misgendered to my face, nervousness and discomfort around trans non-binary status from professionals, and inability from professionals to hold the intersectionality of trans status, queer sexuality, and disabled chronically ill status.
Thank you. There's someone else. Okay.
Lack of follow-up from the medical provider. I go to UNM and there's a lack of follow-up with when I've gone in for an appointment. And then, for example, x-rays were called and no one gave me the status. I got them on my own. And then when I called to speak to the medical professional, no one called me back.
Thank you. Oh,
On another side, I think just being like critically understaffed on the healthcare side, as far as I think we need a lot more MAs and nurses at all of our outpatient clinics. I think we need more mid-level practice providers and primary care providers. And I know there's just a shortage overall, but I think there potentially is enough healthcare professionals, but I think the workplace quality and like our well-being after the past few years has declined. And so I would just love maybe more help on the healthcare side so we can appropriately provide a lot of these things that have been mentioned.
We have a couple comments from online. Staff refusing to ask and fill out identifying SOGI demographic information and charts, and a refusal to conduct tests and being met with indignance once reviewing those tests that were ordered by somebody else.
Okay. One thing, I'm a mental health provider, and I feel like there's a huge lack of known safe inpatient or specifically inpatient facilities for folks who are having to need that higher level of mental health care. I don't know who to refer people to because I basically don't hear anything good in terms of people having their gender identity and sexual orientation validated, affirmed, and feeling physically safe at all times.
thank you. Thank you.
Is it green? Black screen.
So for accessing specifically reproductive health services, like options for sterilization for women is incredibly limited and gate kept, and generally a lot easier for men to access. And I think that's something that isn't really talked about a whole lot as far as providers' attitudes towards that and just general hospital policies towards that.
Thank you.
Anybody else like to comment?
My response is going to be kind of weird. My experience with the healthcare system is none. I haven't seen a doctor in over 20 years. Mostly because I'm pretty darn healthy, thank God. But also because to me, going into a doctor's office is like Russian roulette. I don't want to end up in some fascist waiting room where somebody's going to treat me like other.
Anyone else?
One last thing, I think one of the biggest, so I am fortunate enough to work at Truman, and I love what we do, but I also don't think gender affirming care is a specialty. I think that I would love if all of our primary care providers could have very dedicated training for gender affirming care, because it's very sad when we have to not take new patients, and that's like where we've been at consistently over the past 4 years that I've worked there, is we oftentimes aren't able to take new patients. And so that to me is potentially devastating and frustrating, I think, from the healthcare provider side, and I know especially for our communities. And so I just think that we could do a lot more to train everyone.
Give the time to do it.
Yeah.
Chris?
Sorry. I work at the Center for Reproductive Health, and we have no time to spend with our patients, and we're booking 8 weeks out.
Yeah.
And we're not given any time to see our patients and actually be able to do that. My partner is a pediatrician, and she wants to do gender affirming care for youth, and she's being forced to do urgent care. She has no time to do it. So it's one of those things where we are not given the time to do the care that we are able to do and we know how to do.
I also work at Center for Reproductive Health, so we're both abortion providers. I think one of the hard things too is not having enough support staff. I know we've been talking about this sort of the moral importance of seeing anybody who comes to us for abortion care, but the lived reality since the spring is that we've been turning patients away, and that is the most horrible thing that I could have imagined when coming to fellowship here, honestly.
Anyone else? Oh, only one.
I just want to say I love Truman Health Services. They provide, I do understand the need for more providers that are competent around gender affirming care, and it's really nice to have a place where I know that I'm going to be respected no matter what department I see and what kind of services I receive. And I think that's really special, and I hope we're able to get more capacity on that front too.
Thank you. I think collaborations like the Transgender Resource Center and UNM Hospital have existed because, listening session like this. So it's important for us to know and then identify, what other organizations, what they're doing and how we can partner with them to, in addition to looking into our own internal processes and, politics and all that we can do, but community engagement is under diversity, equity, and inclusion with Fabian as the lead. So it's a new department for community engagement, but our CEO has championed our department. So, we are grateful to be able to have the listening session presented to her and all the leadership. So I will be lying if I say that all of the issues will be resolved. But as much as we have the power to, like I can see training or, cultural education, and then the shortage is, we are trying really hard to hire a lot, and we get, like the statistics of how many people are we hiring, and I think it's getting better in comparison with a few months ago. But thank you for your opinions. Anyone else? I will pass to you. Okay.
Yeah, I'll just use my microphone. I just wanted to share some stuff from an event that happened last May that might be relevant to this conversation. We did a training in collaboration with UNM and also Prez and some other folks, specifically on providing primary care to transgender and non-binary folks. It was a 2-day training held here in Albuquerque and online, like this event. We had over 100 providers from around the state. And I agree that having specialty care is great in the places where we can. We also know that because of all the transportation, poverty, et cetera, other issues we have in the state, that we need folks not to have to travel. Right? We need both, right? We need both options for folks. And I know that what we saw from that training and previous trainings we've done in that area is lots of folks in the state who are interested and willing and have the right degrees and actually have the medical knowledge. But maybe there's a way of building some structures to support them more so that at least when in their first year or 2 or 3 of actively seeing trans and non-binary patients, they know that they have access to folks who are more experts, who have more experience. Because I think a lot of the issues we're seeing in New Mexico, obviously there are folks who just don't want to see our folks. All right, well, I don't know that we can change that. But there's a lot of folks who want to and are ready, but don't feel competent to. And it's not always a training situation because there's not that much specialized medical knowledge that's relevant. It's about feeling like, oh, if something shows up that doesn't fit the norm, will I know how to deal with my patient? So using ECHO or using other resources that we have here at UNM could be a really powerful way to support more options around the state by making those folks who really are experienced and confident and competent accessible to those who want to do this work. Because we can keep offer trainings, but I think we also need to offer the folks beyond the training something that makes them feel safe sticking their toes in the water.
And I will comment, I staff endocrinology endo echo, and we do take gender expansive cases, but I don't think it's something people are aware of. And we've talked, Dr. McLean and I have talked about what could that look like if we did another echo for trans-specific care once a month, what that could look like, but there is opportunity now under the current echo structure. It's just not advertised, not well utilized, not well known. And I think with echo, we have the same, for all of the echoes, I go on the HIV echo, it's the same providers all of the time. And sometimes it feels like that's not the purpose of echo, it's to get everyone else that's not the specialists. Yes, but I would love if we could support maybe advertising echoes more frequently, just to decrease the barriers to the community, all of our echoes for all of the patients.
And we had another listening session too, and what they said is like there is not like a hub for all the resources in the community so I think that's something that not only UNMH can benefit from, but other organizations, and also just if you are, someone just moved and then they are looking for a specific, they can go and, Google and our website, it's a little bit of work, so.
Yeah, and if you guys can share whatever resources you guys know about with us, if they're open to folks outside the UNM system, then we can certainly share that with all the folks that have done trainings with us over the last 5 years, which is hundreds of providers in the state.
And that's what we have found too, we just, people don't know about the resources, and that is just across the community, like we talk about language access or even financial services, everything, just like the resources sometimes are there, but we don't know, because it's a fast world right now, right? We just don't take the time sometimes, but thank you. Anyone else? I will go to the next.
We have a couple of comments from online. One individual commented that it's hard to accept that LGBTQIA plus care training is not required or mandated. It's kept as an option, or an agency or a provider or an agency that a provider can choose to ignore. And one other comment, just giving a great account of the great care they've received at Truman Health Services, talking about patient-centered care, willingness to be corrected, investigative questions, extended appointments to allow enough time, things like that.
Thank you. And this is just to understand also for our own information, what do you need to be healthy?
More support staff at your workplace as well.
Okay, thank you. When you say more support with staff?
More support staff at workplaces, it sounds like that's a theme in general, more
Okay.
providers, more support staff.
Okay.
To be healthy, I think, in your workplace and when you go home, feeling good about what you did today. Yeah, work-life balance, work-life integration, that's what I've been calling it now.
Okay. Anyone else?
More preventative health care. I think your system is just, for when things go crummy. So you have very limited programs on nutrition. Diabetes education should be grossly increased. Even in press, I hate to say it, but press had a good program for healthy food. You need a program like that because that's the biggest shortfall you have is the prevention. You just wait till people get sick and then you take care of them.
Thank you.
To piggyback off that, harm reduction techniques in education.
I think for this question for me, I'm always thinking pretty far. I'm thinking it in terms of basic health, right? Like I need food, I need house, I need education, I need enough money to pay the bills and all of that stuff. So I think the more we can integrate those foundations of community health into healthcare, I think we get to the preventative nature stuff too. But there's so much room to grow in that aspect, right? Whether we're talking about people who are unhoused or just trying to live in Santa Fe as a state government employee, who I think make a decent amount of money, but it's still hard to keep the house there. And I can't be the only one in that boat. So some of that basic community foundations of health.
I think in relation to that, generational supports. So if someone's coming into the doctor and they're experiencing maybe like co-occurring needs, the entire household or the entire family is probably experiencing those needs as well. And so just supporting that one person isn't going to get to the root of the issue and isn't going to sustain their health going forward.
I think we need more support for parents struggling to get their household's basic needs met, so that we're not looking at these negative health outcomes for youth and used to be youth that we see from parents who are actually neglectful, because parents don't always choose to not meet the emotional needs of their children, but they have the same kind of long-term health outcomes of parents who do choose to be that way. I know that there are programs, but there's usually a lot of guidelines that maybe some people don't meet. So I feel like that needs to be available to everyone. And yes, I am reading The Body Keeps the Score right now. So.
Great book.
Duh.
Particularly in New Mexico, but everywhere, I think, we would benefit from a true shift in our medical system to something that is always trauma-informed every interaction and patient-centered, not just throwing those words around, not just offering an occasional 2-hour training, but actually looking at how do we make the system, not the individual interaction, but the system follow those guidelines, which would deal with a lot of the issues that queer folks have and that people of color have and that every other marginalized group has, because we'd actually be looking at the person in front of us and figuring out where they are in the moment and what they need, not trying to fit them into our model of what compliant care looks like. And knowing that the average ACEs score, or this is a score of how many traumas folks have experienced in their childhood in New Mexico, is something like 5 or 6, which is enough to basically miswire everyone's brains. I think if we're not assuming that a significant portion of the folks showing up in front of us have the results in their bodies and brains from trauma, then we can't possibly care for them properly.
Yes.
With my regular day job, what we do, I work in fitness, but bringing in integrative partners within the community that would understand what you're talking about with trauma. We've started to do that within the Pilates community, which is what I'm familiar with nationally. But it's important, and there's a lot of people out that are pseudo healthcare professionals that could help in this whole process, I think. Maybe community education programming, something to that effect.
Talking my language.
I have a few comments here from online. Access to medication and providers that can partner with me to figure out which ones. More mental health practitioners. More surgeons performing gender-affirming surgeries in New Mexico outside of healthcare. A living wage, lower rent. Medicare for all. Access to trained, competent, supportive specialists, and slowing down to talk to me as a fellow human, regardless of paperwork and protocols. No labels, encapsulate individual experience.
I'm a nurse and I'm licensed here in the state of California, and I work with California in a program called ACEs. And they actually pay doctors to work with patients to find out about trauma in their life. And we're not going to get anywhere unless we start paying doctors to take, trauma in kids' life serious. And I think that's the number one thing we have to do. We have to be like California and pay doctors to get, to look at this, to ward off, because if we can take care of things when kids are younger with trauma, we can avoid addiction, jail terms, so many other different things. So that ACEs program in California is terrific, and I hope we do it here in the state.
I'm not sure about paying the doctors, but I think there is a ACEs program. Yeah, they are paid, right? But they do, yeah.
And that's what the doctor will do if we get paid for it. It's nothing personal to the doctor. It's just your time. I know you need that time, so.
Anyone else? Okay.
Thank you. So to kind of piggyback off that, also helping clients find their resiliency factors, because if you just focus on the trauma, then the client won't know how to respond. And then also encouraging clients to apply for assistance like food, clothing, shelter, utilities, because you can't focus on your physical health or anything else if you're worried about survival. And also, a lot of people don't know if agencies don't have applicants, they lose that funding, which may affect people in the future.
Thank you. Anyone else?
Just going off that, I think that more widely available case management services, and not just like like specialized case management services for special populations, but for anyone. Insurance policies are written in a way so that people are not going to understand it. When people advocate for themselves, they're not always as successful as when someone says, "Hi, I'm the case manager." I've been one. I've had a conversation in front of my client who says, "I did say exactly what you said and I wasn't successful." And I say, "Yeah, it sucks, but isn't it good that I'm here?" So yeah, more widely available case management would help with that.
Yeah, I think that's so important. I was joking with a colleague that we were picking our healthcare plans, and I was like, I don't know how to read these. I need my dad. We're not given great education on how to navigate the healthcare system, and like you said, it's purposely worded a lot of times to confuse people, to get them to choose certain things, to cloud their rights, and things like that. And so I think that's really important is people to support you in just walking through the basics sometimes, not necessarily just, health care for your body, but supporting you in making the right choices so that later on down the line, you don't find out, oh, this wasn't covered, but I thought it was covered, and now I owe $500 and I can't pay that, and then you're on a payment plan, and it just gets out of control and spirals really quickly.
It's kind of like a patient navigation. Right.
So this is pretty anecdotal, but I had a client that had a bad time in a UNM hospital and needed some advocacy. I asked 3 people I know that worked at UNM, with and around UNM hospital at the time about their patient advocacy program, and no one knew anything about them that worked there. So is there a way that you could make people more aware of the options they have for advocacy and encourage them to reach out if they need it?
I think, yeah, we'll have a list of contact information, including patient advocacy. So community engagement is one of the only departments that have the email and the website. So we are trying to get that information out, like print a booklet as easy as that, and then with all the services and information for our patients. So yeah, we can do that. Anyone else?
We have a comment talking about insurance advocacy.
Anyone else? No? And then I think this is the last one, and it could be, I think it's been everything that we have been talking about, right? But if there's anything else that you think that we can do, community programming, I have education, training, anything that you can, think of, would like to see in your neighborhood.
Yes. No, it's flashing at me. Fussy microphone. Can someone test the microphone on them? Just, this microphone personally hits me.
Are you hearing me?
Yes, can we get someone to confirm on Zoom whether you can hear us?
Someone said audio is back.
So one thing that I've been advocating for in my community, very particularly, is safe consumption spaces. I really think that we need like these spaces, especially in and around UNMH. And so I'm wondering if we could get, like, or at least the community get some like advocacy from the healthcare community's end to help get that implemented. Because I know particularly Adrian Barboa, who's county commissioner for the National District, has had conversations with that, but I'm not too sure where it's at. But we really do need some advocacy on that end.
And then I can give you my card just to see what that means.
We have a participant that mentioned the Patient and Family Advisory Committee as well.
Okay, thank you.
I'm the director in the urology clinic at UNM, and we do a lot of the orchiectomies for transgender patients. So the system now is not set up very well to be friendly to that situation. So I'm actually working on opening a multidisciplinary clinic that would be for transgender surgical patients. So my ask to UNM would be, please be supportive, because it's probably not going to make any money, but it's very important for the community. I wanted to talk to the Truman people.
Thank you.
And then to back on that, almost exactly, an OR package for people who are uninsured or maybe not necessarily have a home in the state, because it's incredibly pricey for people who don't have availability for that.
We have a Camina training and financial services as part of our community engagement initiative, just to let people know the access that they have. So we will find it on our website soon. So for
if we're dreaming about what you can make I would love, and I don't remember what the name is, but there's some sort of scribe system where as you're in your visit, there's a scribe who's also like helping you document, because myself and all other providers at Truman take work home all of the time, and the more patients we need to see, the more that happens. And if I didn't have to document, I could see a lot more patients and I would be a lot happier. So if we go back to all of the priorities, I guess that would be one of the things that takes a lot of time, that isn't a billable thing, so it doesn't like make my higher ups happy as far as that piece.
I recently attended the National Association for Community Health Centers conference in Vegas, and there was a community health center out of Pennsylvania, and before they went live with DAX, which is Dragon Ambient Experience, the provider puts their phone on the table and starts talking, it listens, it does the note for the provider. They went from days to completion of notes to having 80% completed day of. Wow. So there's DAX, and then there's also Deep Scribe, but there is the technology.
Thank you.
I just want to say that technology like that pays for itself, because then people have the energy to do more and be more present for their patients, and then the reputation gets higher and people come back and want more care there. And unfortunately, we do live in a capitalist billable basis, healthcare ecosystem that doesn't reward actually quality outcomes, except for like not having negative outcomes for Medicare releases from hospitals. But it really will actually bring more money into the system for UNM. So these kinds of, large health organizations can really afford to do those things. It's just the willpower to invest in it, and that the benefit will come back to everyone.
Thank you.
Just to add to that, it's funny because there's so many different perspectives here, right? Like, yes, Dragon, Speak, and all these other kinds of things, like they do improve the time it takes to take notes, but we still need the time, right? To like say it, write it, type it, whatever. And it's just so funny because, I started at a new job almost three months ago, and, the EHR program, they want to do a coaching session, you know what I'm talking about. They want to do this coaching session. And I mean, I'm really timely with my notes, like it's because of my anxiety and my ADHD, but regardless, you know, the coaching person on the EHR side who runs the EHR literally asks me, so why aren't you getting your notes done same day? And I wanted to be like, is that a real question? Like, so I had to answer, like, on my easiest day, I have 5 clients. On my hardest day, I have 7 clients, and that means my only break is lunch, and I ain't using my lunch for that. So it's like, all of these systems need to be on the same page and understand what it takes to put the time in, whether the time is 5 minutes or 20 minutes or an hour, they need to understand that the time needs to be there. And when we're pushed to see clients, sometimes the time's not there till the next day. I have no problem with that, my administrators have no problem with that, but I'm actually being asked this question, and to me, it's just laughable. And that's for someone that has hour sessions. So if I was a psychiatrist or a medical provider, I'm seeing way more than 7 clients in a day.
Thank you. Anyone else? Okay, so I think as part of, to end the listening session, thank you so much for all your input. What will be, the 4 top priorities that you have listened from, your colleagues? One, if you could choose 4, and this is just to kind of give us a guideline, like the priorities that we could work on. More time.
I think the documentation piece, the listening and being able to document would be number 1, and then the hiring of more investment in people who work at UNMH, whether that's community health workers to provide all the way to providers.
Thank you. Anyone else?
For the patient side, I think just improving access to care for patients is really, really important.
Improving access. Can you raise your hand who agree with that?
Yeah. I mean, there's models all over the country about easy access clinics, and we have none of that at UNMH, right? I think the psychiatry tried to do this emergency urgent care clinic model, but like in all the other specialties, there's no easy access clinic. And I think the other idea about community health workers and hiring community health workers to be sitting in all the waiting rooms, doing patient education, but to get somebody from the community to have access in UNMH is like, it's very, very cumbersome. So opening up this system to people in the community and making that a little bit more friendly for volunteers and all these other ideas that have come in, but it takes a lot. And I'm just thinking of the doula program that took so much to get doulas within the UNM healthcare system. And even then, the access is difficult.
Thank you. And then one of the examples, and as I said, hopefully we will be able to do, like system changes, but one of those changes that Dean Fabian and his team work on is for deaf and hard of hearing. During COVID, they have the SPPs that are the support, kind of patient support system, and they were not allowed in UNMH. So what Dee and I work is getting the badges. As like they could go into UNMH as a staff member. So they are options and they are things that we could do to support our patients. So
There's an online comment that kind of relates to that, just talking about the general collaboration between the health facilities and the systems, and education for primary care providers.
more education. Is there anything else that? No?
sorry, I don't know if this goes here, but I have always dreamed and gotten denied grants that I've submitted for coming up with trainings for clinics and pharmacies. So I'm a pharmacist clinician, but when I think about my patients' access when they go to a community pharmacy somewhere, I want that community pharmacist to be trained in LGBTQIA+ inclusive care and language and how to counsel on prescriptions and all those types of things. But I have to write grants for that because no one's gonna pay for my time because I have to be everywhere else. And so I don't know how that looks or what that process is besides continuing to apply for grants, and I have lots of cool notes today to apply for another one. That's just like extra time that you have to take out, I think, out of like your passion areas of like, this is important and therefore I want to make a change. So maybe even like opportunities for internal grants for providers at UNMH or anyone, any employee at UNMH that has like these listening session ideas, and maybe they could write like a little mini grant to get a little bit of funding, or maybe part of their FTE paid to pursue some of these passion areas could be a really cool opportunity. And I don't know when I should have mentioned that, but it's probably not now while we're recapping.
No, that's great.
And I think those are really good ideas. I also think that we might want to look at making it so you don't have to do that, right? So how can UNM perhaps have a voice in working with regulations at the state level that might require all pharmacies to have their staff trained in not just queer folks, but diversity in general, the way we do with primary care physicians in certain areas. It shouldn't be your job, not that you shouldn't do it, right? But it shouldn't be your responsibility as an individual to fill a gap that really shouldn't be there in the first place. So maybe we should try to figure out how to be more systemic about requiring that kind of work.
And I'm excited too, as a new employee, UNM being 1 year, I have met so many individual people and providers that they're doing so much more than, the hours. So, and the community doesn't know that. So one of the things I wanted just like feature, there is much that the providers are doing for our community, and they're just using their personal time and your passion so much better than that. But yeah, we will do. I'm looking for grants too. Anyone else? And to be able to come up with programs too, we need data, right? So we have a survey somewhere that is like 20 pages long, but I'm so sorry, we couldn't format it this way. But if you don't mind just taking the time to fill it out, that would be great. It's anonymous, and then we just need to have it as a demographic for our listening sessions so we can report back for the groups that we have interviewed. So you can, when we present it to our leadership, we can have representation, because representation matters. So we wanted to, make sure we have those. So we have printed surveys, and we have also. It's also shared in the Zoom call. There's a QR code. So thank you so much. I will be here. We'll have my cards if anyone, needs to connect. I will be happy to meet with you. So
thank you to all our presenters. Thank you to Jose for making things work. Thank you to all of you who are here with us in person and on Zoom. For those of you who are here in person, lunch is available in the next room. There are 5 options. There's a ham and cheese sandwich, a turkey and cheese sandwich, a veggie and lentil, which is vegan wrap, Greek salad, and tabbouleh. So there's 3 veggie options. Please help yourself. Once everyone's had one, if anyone wishes to take a second one home, feel free, because there's plenty of extras and they're paid for, so someone might as well eat them and enjoy them. I'll be around, so if anyone has comments you'd like to share with me about this year, next year, or anything, feel free. I would love to hear what you have to say. And I'm really glad that you all came out. Sorry that we couldn't do everything we had hoped to do today, but the stuff that we didn't do today will still be valuable next time, so I promise we will bring it back. Thank you.
Just one last thing for our participants joining us via Zoom. The chat will be provided in full to the organizers, so feel free to add any information in there as well. Thank you.